Since some of these biologics are newer medications, it's natural to have questions about what they are and how they work. Here are a few common questions that we get about biologics. The cost of biologics is an obstacle for me. What are my options? So there are many ways to save on biologics.
Check with the manufacturer. A lot of the makers of biologics have patient assistance programs for people without insurance, or they have copay savings cards to bring the cost of your medication with insurance down.
Another option is a biosimilar. Biosimilars are highly similar to an original biologic, but they typically are lower cost, so they can help you save money on your prescription. Can I get my biologic at my regular pharmacy? Great question. So this also depends on the biologic that you're prescribed. Common biologics like insulin, you can find at any pharmacy. However, some biologics you can only get through certain pharmacies called specialty pharmacies, and others you can only receive through your healthcare provider.
The downside of specialty pharmacies is often their mail order, so you may need to take some extra steps to set up receiving the medication. But the advantage is the staff at specialty pharmacies are specially trained to get your biologic covered by your insurance or at the lowest possible cost, and to make sure you get the medication properly stored when you need it.
If I'm already on a biologic, how do I find out if there's a biosimilar available to switch to? So it's important to point out that not all biologics have biosimilars, although many more should be available in the coming years.
The easiest might be to ask your healthcare provider or pharmacist. They have access to that information and will happily answer any questions you have. You can also check the manufacturer's website or the FDA website for a list of biosimilars that are approved for the reference biologic. Are biosimilars as safe and effective as the original reference biologic?
Yes. In order to be approved as a biosimilar, the manufacturer needs to show that it's highly similar to the reference biologic. So you should expect the same benefits and risks with a biosimilar. What are some of the side effects associated with biologics and biosimilars?
The side effects of your biologic or biosimilar are going to vary depending on the exact medication that you're receiving. But many of them, because they're injectable, cause some soreness or irritation at the site they're injected.
Biologics that treat autoimmune disorders work by calming down your immune system, but in some cases, it may calm it down a little too much, which can increase your risk for an infection.
Most of the time, these are minor infections like colds or a urinary tract infection, but sometimes they can be more severe, like pneumonia, tuberculosis, or hepatitis. It's also common to feel a little fatigued or tired or run down after you receive your biologic infusion or injection. Think of it similar to how you might feel after a flu vaccine. Your body's a little tired and working kind of hard, but usually this only lasts for a short period of time, and then you go back to your normal self, hopefully with less symptoms of your health condition.
If you have any other questions about biologics or biosimilars, you can talk to your healthcare provider or pharmacist like me, or read from trusted sources like the FDA.